Hi, everyone. I'm Dr. Nikola Dragojlovic, Program Director at McGovern Medical School, UTHealth PM&R program.
And I'm Joel Frontera here. I'm the Associate Professor and Vice Chair for Education.
And we'll be navigating you through our residency program, sharing a little bit about everything that we love.
So we're going to start with this PowerPoint presentation, and we're going to split the topics. Dr. Dragojlovic is going to start talking about the residency in general, and then I'm going to talk a little bit about the rotations. So Dr. D, go get him.
Happy to. So this is our UT family, and we would want to share our enthusiasm and everything that we think makes our program great with you guys. We'll go over our leadership structure, our residents, the curriculum. We'll talk about the rotations and what's coming next. We are the McGovern Medical School UTHealth PM&R program at Houston. We have a lot of names. Colloquially, though, we are the most awesomest place in the entire world. We are a 4-year fully accredited ACGME categorical PM&R program. We're based in the Texas Medical Center, and our faculty has over 30 physicians and 10 PhDs on staff. We think that McGovern is an awesome place to learn, but it's also a great place to practice PM&R because of the clinical diversity and the different clinical sites that you get to rotate through as a resident. And ultimately, we're trying to train residents to be the next leaders of our field. So that is why Obi-Wan will tell you to rank us #1.
Of course, it's strong.
So when you're a resident at UT Health, there's lots of great benefits. Awesome recreation center with a pool. There's good work-life programs available through the UT Medical School. Each resident gets 3 calendar weeks of vacation a year, adequate sick leave and retirement benefits that are available from the time you start residency. And some additional benefits available through the UT Medical School include a special wellness hub and AMA membership, which can be useful for getting other clinical resources and access to the JAMA network as you're studying and keeping up to date with clinical care. Our chair is Dr. Gerard Francisco. He's been the chair of our department for many years, one of my mentors and someone who has certainly looked after me as I was a resident and a fellow and now program director here.
You look great on that picture, Dr. D.
Yeah, if you could get those TPS reports out, that would be great. So our residency program has their education office based mainly at TIRR. Kathy Brown is our wonderful coordinator since 2011. She looks after all the residents, fellows, and medical students. We do have some awesome social media stuff like on Instagram and Twitter. So feel free to poke around there and see what fun stuff the residents and the faculty are doing. We have our website, so look through there. You can get to know a little more about the residents there. And in the bottom right corner, you will see Kathy's contact information. So call us or email her if you have any questions or concerns as we go through the interview cycle.
Sorry.
So these are our great chief residents. Heather Nauman is our newly minted administrative chief, along with Aaron Lynn, our academic chief resident. And Noor is our associate chief of wellness. And they are working together to make sure everything runs smoothly and guide the junior residents into greatness. These are the rest of our residents. I won't call out everybody by name except the Fresh Prince of Bel-Air. He's been a resident for like 20 years. And then Grugo is like PGY 1.5. He's doing awesome. Lightsaber.
His name is Grogu, Dr. D. It's okay, I'll let it pass.
And these are our beloved PGY1s. They are currently on wards and doing other rotations based at Memorial Hermann, our flagship hospital in the Texas Medical Center, but we're looking forward to having them in our ranks next fall. So our educational curriculum is multifaceted. We have a lecture series every Thursday morning at TIRR, and that includes lectures that are distinguished with outside speakers, and of course, monthly grand rounds with our department and grand rounds that we can attend with in collaboration with the Baylor College of Medicine. Nearly every hospital site we rotate at has its own didactic activities. So TIRR has its own lectures. Other hospital sites have their own individual lectures available to residents. And then the critical review of the literature is a special project that PGY2 residents complete at the end of their PGY2 year that we'll talk about a little bit later, but culminates in a small research project. And then we have a variety of workshops for you guys to get your hands dirty with respect to ultrasound skills, working in prosthetics and orthotics, spasticity management, EMG, ultrasound, and injections. There's a cadaver-based musculoskeletal anatomy course that you will do with the Baylor College of Medicine residents. And then our neuro and musculoskeletal ACEs program is our physical exam workshop and check-in series to make sure that you're developing those skills appropriately as you go through the training. We also have a dedicated quality improvement curriculum where we have devoted speakers who have large roles and experience in quality improvement. We'll teach you quality improvement principles, and you work with senior and junior residents to come up with a quality improvement project that carries on throughout the year. In addition to that, we have a few other specialty programs that are part of our residency program that we think are different or set us apart from other places. One of them is the Physician Educator Certificate Program, and that is a year-long program helping you develop teaching skills. It has monthly meetings where you will learn about different teaching styles, how to teach to different types of learners, how to build educational content and curriculum, and that culminates in the teaching philosophy statement paper. And we've had residents do this program and really learn new teaching skills that they can use when they're training junior residents or medical students, whom we often have a lot of visitors joining us. And so we fully support our residents whenever they go through the Physician Educator Certificate Program. We also have a healthcare management training program with the UT Medical School in conjunction with the University of Houston, where residents can get a certificate in healthcare management. So for those residents who are interested in the administrative or financial side of graduate medical education and medical practice, that's an additional course that they can take during their PGY3 or PGY4 year to learn the business side of medicine and develop their acumen. Going back to the quality improvement curriculum, so we have dedicated PM&R and faculty mentors teaching you guys quality improvement projects. So in small groups with a dedicated faculty mentor, you will come up with a project and execute it, collect data and evaluate it. And we do a large year-end poster session. Some of these projects have resulted in presentations at local, state, or national conferences. And you can see some of the topics down below that the residents are currently working on. But it's a variety of things. Some of them are patient-centered, some of them are centered around the resident experience. And it's wide open in terms of what you can do. And we enjoy giving the residents that autonomy to take up this quality improvement and carry those skills into their future practice. Volunteerism is a big part of our residency program. Lots of opportunities for you to help out in the Houston community. The RSVP clinic is a clinic that provides wheelchairs, equipment, and other types of DME to underserved patient populations. And they also have monthly clinics that provide PM&R evaluations and physical, occupational, and speech therapy services to patients who don't normally have access to this care. And our residents and some of our faculty participate in RSVP clinic very often. And so it's always heartwarming to see our trainees giving back to the community in this way. The Houston Marathon, the Special Olympics are ways to get involved in sports medicine volunteerism. And there's more opportunities than that, but those are some of the most popular ones that we see our residents participating in. And I'm going to turn it to the SCI expert, Dr. Frontera.
That's right. So we're going to talk a little bit about rotations and what would your 4 years here at McGovern and UTHealth will look like, right? A lot of the questions that come up during interviews is, what's your month-to-month rotation schedule or daily activities? And we touch a little bit about that with the didactics, and this is kind of give you a feel of what the rotations would look like. So of course, 4 years ago, we started doing a categorical year, meaning that we include our first year in our training. And that PGY 1 year is basically, like Dr. D mentioned, it's going to be in our flagship hospital, Memorial Hermann at the medical center, under the supervision of internal medicine. And so our interns will have 4 months of internal medicine wards, 2 months of ambulatory clinics, 1 month of the medical ICU, 1 month of rheumatology, mostly consults and clinic, 1 month of neurology, a combination of inpatient consults and clinic, 1 month of geriatrics, 1 month of cardiology, and 1 month of PM&R. That month of PM&R is divided itself into 2 weeks of inpatient rehabilitation and 2 weeks of outpatient musculoskeletal clinics and procedures. Most of the rotations are at Memorial Hermann in the medical center, but there are a couple of rotations that are going to be in our sister hospital, LBJ Community Hospital, about 10 minutes away from the medical center. The rest of our residents have other, schedules, PGY2s. You have 7 months of inpatient rehabilitation between our inpatient rehab unit at Memorial Hermann and our inpatient units at TIRR. 2 months of consults will be done at Memorial Hermann, 1 month of MSK clinic and procedures, a combination of several of our hospitals, 1 month of EMG at our Harris Health or Harris County Hospital District, and 1 month of TIRR outpatient, which is mostly outpatient neurologic follow-ups with a combination of both musculoskeletal as well as spasticity management, spinal cord injury, brain injury, and other things. PGY3, you have 4 months of inpatient, 1 month of MD Anderson cancer rehab, 1 month of consults at Memorial Hermann, 1 month of MSK, 1 month of MD Anderson pain rotation, which is both outpatient clinic and procedural based, 1 month of EMG, 1 month of the business course, which is not a requirement, but it is our experience that is very popular. 1 month of pediatrics and 1 month elective rotation. PGY4 is a little more flexible, but in general, you see there 2 months of TIRR, outpatient, MSK, pain, whether it's at TIRR or at private practice setting, mostly procedural based, 1 month of EMG and 7 months flexible, depends on a bunch of factors, including interest and other things. So this is our home from above the Texas Medical Center. It's in the basically south of downtown Houston. It's basically a second downtown. It's amazing. It has Rice University to its west, Hermann Park and the Houston Zoo to its north. And it's a small city itself. You can see that there's so many institutions and universities in this place that it's amazing in terms of collaborations and research and the availability of training and exposure to multiple diseases and rehabilitation settings that I think I agree with Dr. D that this is a great place to train.
It's a lot of fun.
In terms of specific rotation sites, we have TIRR Memorial Hermann, which is we have an inpatient rehab service as well as an outpatient clinic. Our inpatient rehab service is a total of 120 beds. We've dedicated traumatic brain injury and stroke and spinal cord injury units. We do have a neuromuscular service as well. We just started a new pediatric rehab unit of 6 beds that is substituting our exposure and our experience at Shriners Hospital for Children. Basically, our rotations are 1 faculty per 1 resident, 1-to-1 teaching. So that's a plus for all of our trainees. We have also a very busy outpatient clinic. We've had more than 12,000 visits in 1 year alone. This data is from 2018, but as you can see, the list of conditions that we treat in that clinic. And we're going to go over some of the numbers for ultrasound guided injections and axial injections a little bit later on, so you have an idea of how much our residents do in terms of procedures. TIRR has been nationally ranked for over 30 years as one of the best rehabilitation hospitals in the country, and it shows, right? We have very good outcomes. We have a lot of referrals from outside of Houston and outside of Texas. We have a significant amount of research funding, making it a well-balanced, well-rounded institution. This is a little bit of a list of our admissions, and you can see there are significant admissions in terms of stroke, brain injury, and spinal cord injury, and that will absolutely create an environment of learning for our residents, that they will be well prepared whenever they graduate to tackle on any job, right? Another of the rotation sites is Memorial Hermann at the Texas Medical Center. It's a level 1 trauma center with more than 1,000 beds. It's a stroke center, and it's also an LVAD and transplant center. So basically, an all-in-one major hospital hub, and our residents do a consult service there, which will you see transplant, you will see LVAD patients, you will see stroke and trauma and medical. So a well-rounded consult experience, as well as a inpatient rehabilitation unit that it's embedded in the hospital. As I mentioned, we also have two MD Anderson Cancer Center rotation. One is interventional pain management, and the other one is cancer rehabilitation, and they're both 1 month. And the pain rotation is mostly outpatient and procedures, and the cancer rehab is both inpatient and consults, and outpatient clinics as well.
I wanted to add the interventional pain management experience that is associated with their ACGME accredited interventional pain program. And that's something that the residents really love, because they get to work with the fellows and they get a lot of teaching and a lot of procedural experience there. Didn't mean to interrupt you, Dr. Frontera.
No problem. Thank you. Thank you. And then we have Harris Health System, which is our Harris County Hospital District, and which has grown in the past several years. LBJ now has a standalone outpatient clinic, and our residents do a joint PM&R orthopedics clinic with procedures as well as EMGs over there. And then we have another rotation at the Smith Clinic, which is mostly EMG nerve conduction studies. They're very busy in that clinic in terms of doing EMGs. We also have MSK sports and interventional pain rotations. This is our faculty. Two of our faculty members, Dr. Sianka and Dr. Bruel, also have private practices, so our residents get exposed to that type of setting in terms of interventional pain and musculoskeletal patients. We also have the rotations at MHOG, which is one of our Memorial Hermann orthopedic and spine hospitals. And you can see the numbers here real quick of how much procedures we do in a 12-month span. This has grown as well in the past year. This is from 2019 numbers, but as you can see, the residents will be exposed and will be able to perform a significant amount of these procedures. We also have a new, as I mentioned before, inpatient rehabilitation unit for children at TIRR Memorial Hermann. And so it's a 6-bed rehab unit, which is opened up about 2 weeks ago and already has a couple of patients. We have coverage from the Pediatric Hospitalist Service to help our kids in that unit. And we also are reestablishing several clinics with Dr. Hall, including CP, spasticity, and spina bifida, both at TIRR and also at the UT Physicians Clinic. One thing that we want to touch here real quick is our call pools. Basically, we have 2 call pools. One is in-house at TIRR Memorial Hermann, and one is a home call to cover the 12-bed inpatient rehab unit at the Memorial Hermann Hospital, TMC. The in-house unit, that only happens when you're rotating a tier on one of the inpatient services, and it's approximately every 5 to 6 days. It's a 24-hour call in-house, and you will go home post-call the next day. At this time, there's also 24/7 hospitalist coverage from internal medicine to assist with any emergencies overnight. The home call, basically, you go Monday through Thursday or Friday to Sunday. And if you have a weekend call, you come in and round in the morning with your attending and then take the rest as a home call. We also have an emergency backup call system to help cover in case of any urgent issues with residents or with late arriving admissions, in which we, this is a good segue to the moonlighting policies, because that emergency backup counts for internal moonlighting. So if you do an admission at tier that it's late arriving, you will get compensated for that as part of the moonlighting. Now, we don't allow external moonlighting. So the only moonlighting opportunity is doing admissions here at tier and doing staffing with our own faculty. Going back to this slide real quick, some rotations do not have a call. MD Anderson, LBJ, and the pain rotations don't have call to those specific sites. Dr. D?
So, in the last couple of years, Dr. Frontera and Dr. Francisco have spent a lot of time building up the interventional and musculoskeletal curriculum for our program. And this continues to evolve, but the way we've tried to improve that experience for our residents is by building in more didactics and workshops, more procedural experience with both private and academic faculty at the various sites that we already discussed, and then improving your access to other rotations for interventional pain and musculoskeletal care, whether those are private pain rotations with Dr. Bruel and Dr. Sianka, whether that is in academic settings like TIRR or the LBJ PM&R clinic, trying really hard to bulk that up and give that good exposure so residents are much more comfortable with respect to performing those skills when they leave our residency training program. And there's been a variety of journal clubs that have been evolving over the course of the years, including resident-driven sports medicine, pain medicine, and concussion clubs. So really well-rounded, and I think really improves the exposure to sports, musculoskeletal care, and interventional pain management. So we wanted to let you guys know where our residents are at with respect to procedural training. So at the bottom of the screen, you will see what the minimum ACGME requirements are for the various types of procedural training that's listed here. And last year's class had absolutely no difficulty meeting any of those requirements. In fact, you'll see that they blew them out of the water. This year's PGY4s, as of December, are doing the same. They will have more than enough procedures to feel comfortable and to meet the ACGME requirements. So we're confident that you guys are getting what you need in terms of these exposures, but there's always ways to give you more, and that's what we continue to do. So a lot of residents come to our program looking to do research, and we have a great affiliation with the TIRR Memorial Hermann research program, and that starts off as a PGY2. You'll have an 8-week research course that's called the Critical Review of the Literature, where you will learn about scientific and research principles, publication principles, learning how to be a good consumer of scientific literature and medical literature and how that is appropriately applied to the patients you're caring for. And then at the end of that course, you'll pick a topic to do a review of the literature on. And this culminates in a large symposium where every PGY2 resident from our program, along with the Baylor College of Medicine, give their presentations, and many have turned these presentations into senior manuscripts or published them in a variety of different journals. So a great way to get your research started. Protected research time is available for those who are interested in doing more research. And the research center that's affiliated with TIRR has its own dedicated research faculty and is home to a lot of different projects with collaborations from different institutions in the Houston area regarding neuromodulation, robotics, its own gait lab. So lots of cool stuff happening in the hallways around TIRR. This is some of the research faculty that are working at the research center. Dr. Francisco, Dr. Sheng Li are doing a lot of research in brain injury rehabilitation, whether that's in stroke recovery or spasticity and the management of that. There's a lot of research happening with robotics and brain motor interfaces with Dr. Yozbatiran and Dr. Chang. Dr. Stampis and Dr. Kuropolu are doing a lot of research in outcomes in spinal cord injury, neurogenic bladder, ventilator management. And so lots of opportunities for residents to get involved in research, whether that's a small part of a project or part of something bigger. Lots of opportunities for you to participate there. And I think the most important thing about our program is what I call the UT family. And something that was very apparent to me when I was a resident here and has made me want to stay on as a fellow and a faculty member and now program director is how important our relationships are with one another, and that everything that we do is more than just coming to work and teaching you how to be a good physiatrist. There's so much more than that, and supporting one another both in our professional lives and our personal lives, I think, is really important mission in our program. We love taking our residents to conferences. Of course, COVID has derailed all the traveling fun, but we continue to support our residents participating in virtual conferences. But these are from AAP PM&R last year.
Yes.
Yeah. So it seems like every year we have more and more residents presenting better and better posters at all these national conferences, and not just PM&R ones, sports conferences, pain conferences, you name it. We support you guys participating and going to all of these. And I'm sure many people are looking forward to traveling again soon. And then trying to plan stuff outside of work that's just getting together and having a lot of fun. Of course, these were pre-COVID days when we were getting together at a faculty member's house or getting together at one of the residents' houses for meals and having a chance to break bread and be with one another outside of work, helping, continuing to foster that sense of family in our program. And certainly, 2020 has been a very pivotal point in terms of race relations in the United States. And, we're thankful that our faculty and residents and fellows were a big part of all of the things in the Texas Medical Center related to advocating for the underserved populations and those who have been disadvantaged. And something that continues as a nice trend in our program is Dr. Francisco's family meals. So it is very common for Dr. Francisco every quarter or so to help us get together and eat at the restaurants that he enjoys in Houston. If you haven't heard, Houston has an awesome culinary scene, and Dr. Francisco knows all of the best restaurants. And so we are very lucky to have the opportunity to get together and try new things. Thanks to his support and his willingness to, share his love for food with all of us. So these are some snapshots from, all the times we've sat around the table throughout the years. COVID, of course, put a little bit of damper on that. So we did some virtual ones a couple weeks back. That was really fun.
This is part of our wellness initiatives. We incorporated some wellness and team building activities into our Thursday didactic sessions, again, pre-COVID, but we tried to incorporate that as part of, our commitment to resident and faculty wellness and having a chief resident for wellness, as well as a vice chair for wellness. And like Dr. D mentioned, we've had multiple, Zoom meetings and multiple virtual activities. This is the last one we did a couple of weeks back. It was our holiday dinner party. Dr. Francisco and the department was gracious enough to, order some food for each and every one of us, and we took it home and had dinner in our respective homes and shared through Zoom for an hour or so while we ate. So we're very grateful for that and the time that we get to spend with the residents. So, and so this is this last, holiday season, last Christmas, which we hopefully will restart next year for next holiday season. In the meantime, we will continue to be safe and socially distance, and hopefully we'll be able to, join for dinner again soon, because dinner is very important, especially if you live in Houston. As Dr. D will tell you now, this is an amazing city for foodies, right, Dr. D?
That's very correct. I am a very amateur foodie compared to Dr. Francisco, but I will say that, for people who love, variety of food, Houston is a great place. But I think in general, Houston is a really nice city. It doesn't have the notoriety of New York or Chicago or LA, but it's a fantastic city because it has all of those urban features, but it's very livable and very approachable. And I like the fact that in Houston, there's a lot of people not from Houston. And so that makes people really friendly and want to get together a lot and do a lot of things, especially when the weather is nice. And we try to maximize all our time in parks and getting out and doing stuff outside. And for someone like myself, who is originally from California with no previous Texas ties, Houston has been a lot of fun and very good for myself and my family. And it provides a good quality of life that's very comfortable, a very easy place to settle into, especially as a resident. If you're coming from elsewhere, it's very easy to find a good place to live, get settled, and not have to worry about some of the other things that go along with living in, more expensive or more difficult to access cities.
Yeah, I agree. I think Houston is a great city to live in, and it keeps you in. I did my fellowship here, and I thought I was going to be here for a year or two, and it's been 11 years since that. So, and the same you can see from our faculty and our residents, that a lot of residents actually come back to work in our department as faculty or around Houston, and so that's a testament of what the city can do. They're willing to come back and settle down in the city. So I think that's very important, and it says a lot about that specific city. And remember, when you're reviewing programs, you have to look at where it is. You're going to spend 3 or 4 years of your life there. So not just the program that needs to be compatible, but also the city where you're going to live, who you're going to be with, and what places are you going to visit, and all those things. So I think it's also very important to look at the city. So I think we don't want to take any much more of you all's time. So Dr. D.
So thank you so much for paying close attention, and best of luck on the interview season. And don't hesitate to contact us if you have any more questions.
Absolutely. I hope you guys have have a great holiday season and a happy new year, and we'll see you soon. Thank you.